There's a medical lab test that I would have banned if I had the power to, and I'll tell you why. So about 6 months ago, a woman came in to see me, and I greeted her, asked her how she was doing, and asked what the problem was, and she handed me a lab result. I looked at the lab result. It was a Widal test. And I told her, okay, what do you want me to do with this result? And she told me she wanted me to give her malaria and typhoid drug. Now, this is very common, so I wasn't surprised. So I tried to do what I do with other of my patients, which is to educate her. So I told her, ma, this Widal test is not an accurate diagnostic test for typhoid. I explained to her that the test at best would serve as a screening test, and that what the test would do, if I was to explain in layman terms, was to show the footprint of the bacteria that causes typhoid. And that just because you see my footprints does not mean that I'm there. I could have come here and gone and you saw my footprints, but that doesn't mean that I'm there. That the best test for diagnosing typhoid was a blood culture test. I even told her that most of the patients who had come to me that thought they had typhoid based on the Widal test, that when I asked them to do a blood culture, the blood culture did not see typhoid. This woman had already made up her mind. So she told me, doctor, please just give me the antibiotics, please. So I asked her, ma, what is the problem you're having now? She told me she's having a headache. I said, is there any other thing? She says she's having a little joint pain. I then told her that these are not specific for typhoid. Your headache could have been caused by a lot of things. It could be dehydration, it could be stress, it could be many other things. Then respond saying this is how her own typhoid used to do her, that she has been treating typhoid every month, and that the doctor who usually used to treat her is the one that asked her to go and do this Widal test. And she wanted to see him, but his shop was closed. When she said shop, something triggered me in my head, because doctors will not stay in a shop. So I asked her, which doctor is that? And she brought out her phone and showed me his picture. It turned out that this person was a chemist and not a doctor. And this particular person has met me before for health concerns. She valued his own opinion more than mine because he was older than me. I told her, ma, every single time you have this type of headache and you go there, they give you an anti-malaria, they give you an antibiotic for the proposed typhoid, and they give you paracetamol. Now, it is possible that it was only that paracetamol that solved the headache that you were having, but you have now taken an antibiotic that you didn't need. And this is one of the causes of antibiotic resistance. And I told her I was not going to prescribe any antibiotics, that if she really wanted to know if she had typhoid, we'll do a blood culture. This woman stood up, got angry, and left. I didn't see her again. Now, fast forward to this December, this woman fell really sick and was taken to the hospital. A diagnosis of sepsis was made. For those who don't know what sepsis is a serious complication of a bacterial infection in the blood. When they did a blood culture, it turned out that the bacteria responsible for that was resistant to multiple antibiotics. Now, for people who don't know this, I don't think there's anything more scary to a doctor than seeing a culture result that comes out with multiple drug-resistant bacteria. Many people are scared of